can all be seated. Well, good afternoon. Welcome. My name is Joan Vitello, and I have the honor and privilege to be the dean of this phenomenal school known as the Chingfen Graduate School of Nursing. Welcome, Provost Flott, faculty, staff, family members. You have really persevered with your students, with our learners, and of course our learners, our DMP2s, who will be donning their white coats today. Welcome and congratulations. So, I want to first of all give thanks to several people who made this time possible. First of all, starting with Sue Collette. Sue, stand up and get a round of applause. Sue has really been the mastermind of this. She's told me where I need to be, when I need to be here, and what my script needs to look like. So thank you, Sue. Danielle, where are you? Danielle Blau, my executive assistant, has also been unbelievable. And then I've got phenomenal staff. Ann, are you around? Ann Reardon and Diane Quinn, where are you? Is Diane here? All right. And Max, our Assistant Dean of Student Life. Welcome, Max. And welcome to the faculty and the staff, the rest of the staff. So I want to be the first, as your dean, to congratulate you on making this transition into clinical practice by donning a white coat. When you graduate from this awesome school, and you will graduate in less than 2 years, I would like you to ponder one question. What is the legacy you want to leave as an NP? I have become very clear to the legacy I wish to leave, and that is to be remembered as a nurse first, a leader second, and a learner always. The first two descriptions, nurse and leader, are very understandable, but what does it mean to be a learner always? I am reminded of the famous quote by Confucius, whereby he stated, "Learning without reflection is a waste. Reflection without learning is dangerous." The practice of self-reflection is known as being a reflective practitioner, which I truly believe is the key to becoming a learner always. As we pause to make sense of the care we have provided to patients and their loved ones, we should maintain a sense of curiosity, open to possibilities, stepping into practice moments, and being present and listening for stories and life narratives with our patients. According to Jean Watson, in the nurse's presence in listening to and becoming part of another's story, we are able to promote health or become instruments of healing. Let me share a story. When I was a critical care clinical nurse specialist at University Hospital that later became Boston Medical Center, and I cared for Dorothy in 1988. Dorothy was a patient for several months in the surgical ICU, where she lingered with end-stage cardiac disease following cardiac surgery. Her daughter Sue, a nurse, had given birth to Dorothy's first granddaughter, who was only 3 months old, but unfortunately, Dorothy was never able to see her. Sue kept insisting about Dorothy, that Dorothy would not die until she could lay eyes on her granddaughter. I then went and asked Dorothy if she wanted to see her new granddaughter, and all she could do was nod once, as her failure had left her quite debilitated. So Sue and I went through all the proper channels to bring her new daughter and Dorothy's only granddaughter in to see her. This was, remember, back in 1988. Dorothy was able to touch this precious baby and gave the one and only smile we had ever seen on her face during her hospitalization. Dorothy died 1 day later. This experience led me to ask, what lessons did I learn about myself? What could I have done differently to assist in becoming an even greater practitioner? Being a reflective practitioner has been referred to in the nursing literature as the antidote for burnout. I think of it as helping us reaffirm why we do what we do as nurses and help us learn much more about ourselves. Knowing who I am and what is important to me has allowed me to stay true to my legacy of being a nurse first, a leader second, and a learner always. So I ask you once again, what is the legacy you want to leave as an NP? Congratulations once again as you continue to make this transition into advanced practice and wear your new white coat. Thank you. I kept that brief, didn't I? Okay. Now I'd like to invite Dr. Terrence Flott, who is the person I report to, but has become certainly a friend and a colleague up here. He is our Dean and Provost. He's the Dean of the School of Medicine and Provost of UMass Chand's Medical School.
Great. Well, thank you, Joan, Dean, and good evening. Let me add my words of welcome to all of you and my congratulations to the members of the TAN Chingfen DNP 2 class who are making your transition to clinical practice this evening. Congratulations also to your family and friends, supporters, and to the faculty and deans, and especially, again, to Dean Joan Vitello. Joan, thank you for your partnership, for your leadership, and for really nurturing this DNP program. This is a joyful moment for all of us, I think. It's a momentous occasion as you don your white coats and take on a new role as the healing mantle, if you will, of being a provider. So in preparation for this meeting, I refreshed myself a bit on the history of nurse practitioner practice in the United States. Came across a great article from Arlene Keeling, who's a professor at UVA in the nursing school, PhD RN. And she relates about some of the early experiences in the U.S. in advanced nursing practice. In each of these very early experiences in the late 1800s and in the early 1900s, advanced practice nurses filled voids where there was no other access to care, whether it was in the Lower East Side of Manhattan and with impoverished new immigrants or in rural Appalachia in Kentucky. Now, in more recent decades, in the 1960s, advanced practice nursing emerged around primary care. And it has a real linkage to pediatrics, and I'm a pediatrician, so I knew a little bit of this, and I learned more from this article, and I'm going to relate it to my own experience. In 1965, I know you, most of you, none of you were born, maybe even some of the faculty weren't born. Anyway, there was an assistant professor named Loretta Ford and a pediatrician named Henry Silver who envisioned a nursing role that could bridge the gap between the healthcare needs of children and families and their ability to access care. And what they intended to do was to educate graduate pediatric nurses to provide healthcare services in rural clinics in Colorado. And that really snowballed into the multiple different specialty areas of advanced nursing practice that we know today. Now, my own experience with NPs began only about 20 years after that. I was an intern in pediatrics at the Johns Hopkins Hospital in Baltimore in the mid-'80s. And we, of course, had, I don't know if you know this, but still to this day, pediatric residents have a continuity clinic. So no matter what other clinical rotations we were on in the hospital, neonatal ICU, whatever, we had the opportunity really to get out of that for 1/2 day a week and have our primary care continuity clinic, building up our own panel of patients. And one of my preceptors was a nurse practitioner named Mary, and she was phenomenal. She taught us many things. She had her own panel of patients, actually, as a primary care pediatric nurse practitioner, but she cross-trained us in some things that we hadn't learned in our textbooks and in our formal medical training, even though we were all trained physicians who had matched to a very, very prestigious residency. So she trained us how to give IM injections using oranges. I know it's still a well-established method. She trained us where to give IM injections. So when you're a pediatrician, your babies come from newborn, preemie, all the way up. So, anterior thighs for infants and deltoids and gluteus for larger volumes, sub-Q injections. MDs really didn't know that very well. And then even intradermal injections for TB skin tests. So we got to practice all of those things, but with the directed care that came from someone who had a background, came out of the tradition of nursing, but was functioning as a provider. We learned about she had a background as a lactation nurse. We learned about breastfeeding, something we wouldn't have, certainly I wouldn't have known anything about, and learned about the problems, that lactating moms had and that babies had. She explained to us about all the variations we were going to hear, especially from new moms, about what baby's poop looked like and what could be normal and how not to have people think it was abnormal, all the different changes that could happen with breastfeeding in terms of these essential functions. And they sound funny, but in fact, the key point was filling that gap for anxious mothers and understanding how to have that bond, maybe in ways that we're certainly not on the board exam for medical school or had much of a factor in being selected to pediatrics residency, but was essential to pediatric practice. It also began, as we advanced a little bit more, to learn about troubled moms, depressed moms, postpartum depression, other kinds of issues that families could have. A lot of the families in East Baltimore had HIV at that time, and there were babies. Some of the babies had congenital HIV. It was hard to have those conversations with families, but coming out of the nursing background, we could get a slant on primary care that was informed with that. Now, over the years, I would say just as I took care of older patients, maybe my own practice matured some, and my longtime clinical practice partner was a nurse practitioner. She had her patients, I had mine, but we consulted each other in different ways. Her familiarity and her comfort with family dynamics, with adolescence, relating to adolescence, was a great benefit to myself and to my patients, and also certainly to them. The point here, I guess, is that advanced practice nurses play so many different roles, whether they be as independent practitioners in rural areas where there's no other access to care, whether they be as part of interprofessional teams, if they're part of interprofessional practices that work in parallel and in consultation with other healthcare professionals. And I valued all those partnerships over the years. I've learned to value them. And then beyond practice, I've learned to value them with our nurse practitioner colleagues who are part also of the faculty of the broader UMass Chan Medical School. And then certainly also in leadership. We are stronger when we are partners in practice, and our patients are the ones who benefit from that. I just want to bring this back a little bit and point out that we hope very much that each of you in your future practices will have the opportunity to affect your patients' lives and your colleagues' lives in these different ways, to be able to teach each other and other people you might be practicing with, to work with families to build up that alliance with them, to get them through the tough times. You've decided beyond nursing to take it to another level as their advanced care providers. And when you can fill that gap, when you can fill an access or a care void that no one else can, boy, that's a tremendous difference. And I just hope that your practitioner careers, and I'm very hopeful, very optimistic that they'll be filled with meaningful experiences of patients and families, as ours has. So thank you for having this event. Congratulations on your white coats. Congratulations on being the first cohort to have a formal white coat event. And I look forward to the rest of the ceremony. So thank you all very much.
Thank you, Provost Flott, for such a meaningful set of remarks. We really appreciated it. So now I want to invite both Madeline, better known as Maddie Lane, and Kelly Garcia, who are our DNP 3 students. They'll be graduating this June, to share the meaning of the nursing white coat. And you got your right here. What do you need?
Did they click the slides?
Right there.
Okay, I think that should work. Okay. No worries. Hello to all, both here in person and those joining us remotely. My name is Madeline Lane, and with me is Kelly Garcia. We are members of the UMass Tan Chingfen Graduate School of Nursing DNP class of 2023. And it is an honor to be here this evening. Tonight is a joyous night, the purpose of which is to celebrate those members of the class of 2024 as they enter their clinical year. This evening, we get to come together as a school with our dearest family and friends to recognize the work of this group of students and all they've done so far and mark the beginning of their transition into the advanced practice role. This ceremony is the product of many hours of student-led initiatives over the course of several years, with many champions along the way. We would be remiss if we did not acknowledge these many individuals. From Stephanie DiTomaso, a 2019 DNP graduate, to Emily Davenport, Grace Sherbrell, and Ezekiel De Leon, members of the class of 2022, as well as all student members of the 2020 and 2021 GS&O executive boards and the White Coat Ceremony Task Committee. A special thank you must be voiced for the specific work of both Ezekiel and Emily for sharing their work on the history of the white coat and its symbolism that we will be sharing with you tonight. But first, we would not be here today without our supportive faculty, including Dr. Karen Dick, Dr. Jill Tarian, and our dean, Dr. Joan Vitello. Finally, the world that is the GSN would not spin without the amazing administrative work of Sue Collette. A sincere thank you to all that have made this night possible. There we go.
Awesome. So it is no secret that the clothes that we wear are a form of expression, symbolism, and often a reflection of time and society at large. For this reason, as you gather here today, about to don your white coat, it is important that we explore the history and the meaning of not only the white coat, but the clothes and forces that have led us here today. The clothes worn by nurses have greatly changed over time. In the western corner of the world, the beginning of the nursing profession as we know it is accredited to the work of Florence Nightingale. Her work in the Crimean War, her polar era diagrams, and her demonstration that educated women could impact health outcomes were monumental assertions to make in the 1800s. Prior to Nightingale, nursing activities were left to prisoners working off their sentence or nuns wearing their habits as they tended the sick. As the nursing profession took hold and became an activity open to the secular sect, Nurses' uniforms reflected those of the sisters and gender norms of the time. These uniforms were typically ankle-length dresses with aprons for easy laundering, belts to hold instruments such as scissors, and caps to hold nurses' hair. Interestingly, some disliked this uniform given its resemblance to that of a maid. These uniforms were often black, gray, or blue, matching the habits worn by the sisters. But that norm later moved to white uniforms as the nursing profession championed the principles of antisepsis, cleanliness, and order in parallel to physicians, and practically speaking, the white action of bleach itself. Later, during times of war, capes for superheroes, of course, were added alongside caps with stripes to designate seniority and status. Then during World War II, nurses in the US were given clothes similar to that of soldiers. Nurses who were, as we know back then, mostly women, began wearing pants when many couldn't. But in the 1960s, pants finally became more accepted in women's fashion, along with that era's wave of feminism behind it. Fast forward to the 1980s, where white skirts or white pantsuits were the norm on the nursing floor. We have now come a long way, where scrubs of any color or pattern are readily available and worn by all.
All right. Not only have nurses' uniforms changed over time, but so have those of our physician colleagues. Prior to the 1900s, physicians often donned the color black. During this time, to be seen by a doctor was often an effort of last resort. It is believed physicians wore black as a reflection of the gravity of this interaction, as well as the often inevitable death that would ensue. But all of that changed with the new framework of antisepsis, and with it came the color white. This change is visually depicted in the American painter Thomas Eakins' two works, The Gross Clinic in 1875, on the left, named after the surgeon Dr. Gross, and the Agnew Clinic in 1889 on the right, named after the surgeon Dr. Agnew. Only a 14-year difference, yet notice the gloom and barbarism on the left in comparison with the light, purity, and orderliness on the right, which, if you look closely, also includes the merciful use of anesthesia. Certainly a profound leap forward in the practice of medicine overall, and as we have it, let us not forget the presence of the nurse donning her white hat. From the time of the Agnew Clinic on, the color white and the coat itself took on a symbol of health, scientific excellence, and importance.
So let us fast forward again about 100 and some odd years to 1993, when the white coat took on a new meaning thanks to Dr. Arnold Gold, a clinical neurology and pediatrics professor at Columbia University. Dr. Gold, heralding the need for humanism in medicine, championed the white coat as a symbol of compassion, collaboration, and scientific excellence. Dr. Gold founded the Gold Foundation, which worked to spread this message across many different healthcare professions. In fact, on the lapel of your white coats today, you will find a pin from the Gold Foundation with an infinity symbol and the words, "Keeping Healthcare Human." This pin is meant to provide a visual reminder to students that in order to deliver the best care to their patients, compassion and empathy must be the hallmark of their clinical practice. Today, several healthcare professions don the white coat, in addition to physicians and medical students, including scientists, nurses, nurse practitioners, physician assistants, physical therapists, nutritionists, administrators, and many more.
Fellow students, from your gap year or traditional BSN education to now, we all have had the privilege of being steeped in the practice of nursing. The American Nurses Association defines nursing as a caring-based practice in which the processes of diagnosis and treatment are applied to the human experiences of health and illness. We have had the privilege of being educated under the Chingfen Graduate School of Nursing mission to prepare nurses who embrace diversity and promote health equity to improve the quality of life and human health in the Commonwealth and beyond by leading and innovating in education, research, healthcare delivery, and public service. The white coat, with its symbolism of humanism, collaboration, and scientific excellence, parallels our understanding of nursing and nursing science, our principles and values of nursing, and our mission as members of this university. With that, I would like to ask Dr. Susan Feeney, Director of the Adult Gerontology and Family Nurse Practitioner tracks, to join us for the presentation of white coats to the class of 2024.
I may have to stand on my tiptoes, but I want to take a moment just to welcome everyone, to our students, family members, friends, and faculty to this wonderful event. I would like to welcome all of you entering the Nurse Practitioner clinical year, so our Adult Gero Acute Care track, our Adult Gero Primary Care track, our Family NP track, and our Psych Mental Health track. Welcome. As mentioned, this ceremony is to welcome you as you transition into advanced nursing practice. This will be a journey of transformative growth, of advancing and broadening your nursing foundation. We are here this evening not only to welcome you as you enter your advanced practice year, but to celebrate this important milestone with you. The rite of passage, as other important rituals you have experienced, such as pinning, or will in the future, such as graduation, are ways we recognize and celebrate transition to new experiences or roles and help us intentionally focus on the transformation ahead. So let's start this journey together, shall we? Dr. Alex Menard, will you please come forward? And as I call your track's name, please stand as a group and come down and stand in the front. So may I please have the Adult Gerontology Acute Care NP track. Jaslyn Bennett. Gregory Brodsky. Allison Carlson. Diana Chamberlain. Christina Conley. Shayna Dietrich. Gianna DiPinto. Peter Harris. Rebecca Litwin Snyderman. Christy Mangicotti. Nicole Matson. Grace McCullough. Angela Patterson. Maggie Quinn. Francis Carlo Sabas. Reginald Soprong. Jacob Waldman. Dr. Rachel Nemec, Family NP Track Coordinator, will you please come to the podium? Thank you. Oh, it's much better up here. I like this. So will the Family NP Track students please stand and come to the front of the stage? So. Noah Barkley. Carla Burns. Marissa De Silva. Maria Cosamini. Oscar De La Rosa. Emily Dillon. Samantha Ellis. Kendra Collins. Rachel Gitayi Murumba. Edward Glazebrook. Morgan Hill. Courtney Hunt. Courtney Mantilla. Reham Musa. Joshin Narula. Rachel Odilia. Kamal Sidhu. Amanda Sylvia. Jackie Bedham. Dr. Danielle Hebert, coordinator of the Adult Gerontology Primary Care Track, please come to the stage. And will the Adult Gerontology Primary Care NP Track students please stand and come to the stage. Isabella Damari. Maria Karamortopoulos. Grace Malone. Patricia, Patricia Quill. Will Dr. Martha Agbali, assistant professor and the psychiatric mental health track, please come to the front? And will the psychiatric mental health NP track students please stand and come to the front? Chico Dieri Ibe. Cassandra Gale. Lisa Hunter. Nishu Naik. Shira Newman. And Kayla Thomas. And I'd like to invite Madeline Lane and Kelly Garcia back up to the podium to recite the nursing pledge. Go ahead. You as tall as you want.
You don't need it.
All right. At the beginning of this deep dive into historical fashion trends, Kelly said, "It is no secret that the clothes we wear can be a form of expression, symbolism, and often a reflection of the time or society at large." Class of 2024, your donning of the white coat reflects a new chapter in this history. From habits to habit-like made uniforms, entrenched in religious and gender standards, to the utility and equality of pants with pockets, to now the white coat. It offers a new tradition for us to come together as a community and revel in both the value of nursing and our identity as nurses. Further, speaking from experience of a student who has been in your shoes, ready and excited to begin this next big step, I'd like to offer a few pearls as you begin this monumental transition. First and foremost, never lose sight of the nurse in you. Use your experiences and education thus far, but also rely on the innate compassion and beneficence with which you first entered this field. Today, we are signifying the beginning of this transition, which will extend over the next many months. There will be moments of great triumph, but there may also be feelings of shortcoming. However, even in times when you may feel like you know little, we are here, and we will continue to be here, to tell you that that isn't true. Study as hard as you can. Write down every pearl that comes your way. And don't ever lose sight of the truly awe-inspiring learning you are doing each and every day. For every moment of imposter syndrome, there will be many more moments of brilliance. Run with those, expand on those, and know that more will continue to come. From experience, I promise they will begin to string together until suddenly you begin to feel it, the feeling of becoming a nurse practitioner. So today, the coat you are now wearing offers a new symbol and tradition to reaffirm your promise to the nursing profession. From today forward, set out to provide guidance without influence, provide resources without coercion, and provide care without bias. Personify the compassionate, patient-centered nursing model that has so expertly been crafted by the nurses who have come before you as you continue on in your graduate education as nurses, leaders, scientists, and innovators.
So, without further ado, class of 2024, we ask that you all now please stand as a group to recite the Nightingale Pledge. We also invite any nursing faculty or fellow nurses in our audience to stand and recite with us as well.
Ready?
I solemnly pledge
myself in the presence of this assembly to practice my profession of nursing faithfully.
I will provide care where care is needed and shape the environment in which care occurs so that the promise of caring may be fulfilled. I will center my practice on the welfare of all those in my care, honoring the fullness of their humanity. I will hold in confidence all personal matters committed to my keeping. I will refrain from any action and will not knowingly take any action that will do harm. I will maintain and elevate the standards of my profession through reasoned inquiry and faithful scholarship, and by embodying the integrity expected of me by my peers and those I serve.
Congratulations.
All right, well, what an afternoon, or we finished this in record time, 5:47. Guess what comes next? Appetizers and drinks. We're going to celebrate you. So I would ask you all to please go downstairs to the multipurpose room and enjoy the camaraderie of being together, all in your white coats. And congratulations again, class of 2024, on donning your white coats. I'm so proud of you. Congratulations. All right, go forward and grab something to eat and drink.